Study Session 8 Levels of Healthcare System and Recent Developments in Health Financing in Nigeria. Introduction. In this lecture, we shall discuss levels of healthcare services in Nigeria, as well as some recent developments in the healthcare financing. To do this effectively, I shall start by critically examining the three levels of care, namely the primary, secondary, and tertiary levels. This will be complemented with an examination of some recent developments in the healthcare financing in Nigeria, with special reference to National Health Insurance Scheme (NHIS). Objectives. At the end of this lecture, you should be able to 1. Discuss the primary health care in Nigeria. 2. Discuss the secondary health care in Nigeria. 3. Discuss the tertiary health care in Nigeria. And 4. Discuss some recent developments in the health services financing in Nigeria. Pretest. 1. Explain primary health care in Nigeria. 2. Discuss secondary health care in Nigeria. 3. Comment on tertiary health care in Nigeria. And 4. Discuss the recent developments in healthcare financing in Nigeria. The national healthcare system shall be examined at three levels. Primary healthcare. Primary healthcare, as the entry point of the healthcare system, shall provide general health services of preventive, curative, promotive, and rehabilitative nature to the population. The provision of care at this level is largely the responsibility of local governments with the support of states' ministries of health and within the overall national health policy. Private medical practitioners can also provide health care at this level. Noting that traditional medicine is widely used, that there is no uniform system of traditional medicine in the country, since there are wide variations with each variant being strong to the local culture and beliefs, the local health authorities shall, where applicable, seek the collaboration of the traditional medical practitioners in promoting their health programs such as nutrition, environmental sanitation, personal hygiene, family planning, and immunizations. Traditional health practitioners shall be trained to improve their skills and to ensure their cooperation in making use of the referral system in dealing with high-risk patients. Government of the Federation shall seek to gain a better understanding of traditional health practices and support research activities to evaluate them. Practices and technologies of proven value shall be adapted into the healthcare system, and those that are harmful shall be discouraged. As defined in the Alma Ata Declaration, primary health care shall be the key to the development of the national health policy. Primary health care is essential health care based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. It forms an integral part both of the country's health system, of which it is the central function and main focus, and of the overall social and economic development of the community. It is the first level of contact of individuals, the family, and community with the national health system. It brings healthcare as close as possible to where people live and work, and it constitutes the first element of a continuing healthcare process. Secondary healthcare. The secondary health care level shall provide specialized services to patients referred from the primary health care level through outpatient and inpatient services of hospitals for general medical, surgical, pediatric, patient, and community health service. It shall also serve as administrative headquarters, supervising healthcare activities in the peripheral units. Secondary health care shall be available at the district, divisional, and zonal levels of the state. Adequate supportive services such as laboratory, diagnostic, blood bank, rehabilitation, and physiotherapy shall be provided. Tertiary health care. Tertiary health care, which consists of highly specialized services, shall be provided by teaching hospitals and other special hospitals which provide care for specific diseases, conditions of specific groups of persons, e.g., orthopedic, eye and psychiatric, maternity and pediatric hospitals. Care should be taken to ensure that these services are evenly geographically distributed. Appropriate supporting services shall be incorporated into the development of these tertiary facilities to provide effective referral services. Selected centers shall be encouraged to develop special expertise in the advanced modern technology, thereby serving at the secondary and tertiary levels. Whilst high priority shall be accorded to primary health care, within available resources, the secondary and eventually all Nigerians shall have access not only to primary health care facilities but also to secondary and tertiary levels as required. Particular attention shall be placed on the needs of remote and isolated communities which have special logistic problems in providing access to the referral system. In the Constitution of 1999, health is on the concurrent list of responsibilities with the exception of the external health relations, quarantine, and control of drugs and poisons, which are exclusively the responsibilities of the federal government of Nigeria. The Constitution also assigns specific responsibilities to the local government, fourth schedule to the Constitution. The national healthcare system is built on the basis of the three-tier responsibilities of the federal, state, and local government. Schedules of responsibilities which are to be assigned to the federal, state, and local governments respectively shall be prepared for approval by the Federal Ministry of Health. Recent developments in public health financing in Nigeria. Health insurance is a social security system that guarantees the provision of needed health services to persons on the payment of token contributions at regular intervals. The National Health Insurance Scheme, NHIS, is a corporate body established under Act 35 of 1999 Constitution by the Federal Government of Nigeria to improve the health of all Nigerians at an affordable cost. The NHIS Act is the statutory authority for the scheme's benefit programs as well as the general rules and guidelines for the operation of the scheme. The evolution of the National Health Insurance Scheme dates back to 1962, when the need for health insurance in the provision of health care to Nigerian citizens was first recognized. The government had initially provided free health care for its citizens, funded by its earnings from oil exports and general tax revenue. However, the global slump in oil prices in the 1980s greatly affected Nigeria's major source of income. Therefore, the government could no longer afford to provide free health care and subsequently introduced several cost recovery mechanisms like user charges and drug revolving funds. Furthermore, the introduction of the Structural Adjustment Program in 1986 adversely affected the health sector allocation. These, among other factors outlined below, informed the establishment of the insurance scheme. 1. The general poor state of the nation's healthcare services. 2. the excessive dependence and pressure on government-provided health facilities. 3. Dwindling funding of healthcare in the face of rising costs. 4. Poor integration of private health facilities in the nation's healthcare delivery system. The objectives of the scheme. 1. To ensure that every Nigerian has access to good healthcare services. 2. To protect families from the financial hardship of huge medical bills. 3. To limit the rise in the cost of healthcare services. 4. To ensure equitable distribution of healthcare costs among different income groups. 5. To maintain high standards of healthcare delivery services within the scheme. 6. To ensure efficiency in healthcare services. 7. To improve and harness private sector participation in the provision of healthcare services. 8. To ensure equitable distribution of health facilities within the Federation. 9. To ensure appropriate patronage of all levels of healthcare. 10. To ensure the availability of funds to the health sector for improved services. How the NHIS works. In order to ensure that every Nigerian has access to good healthcare services, the National Health Insurance Scheme continuously improves the way it works. The information and diagram below shows you how the NHIS structure works. Patients. Patients have been getting excellent care in the NHIS since its inception, but this excellence has been patchy. Now, patients are being encouraged to become actively involved in their own care and are helping to shape local services in the following ways. 1. They are making real choices about when and where to be treated. 2. They are being recognized by health professionals as equal partners in their care and are being empowered to manage their own symptoms and medications more effectively. 3. They are making decisions about local services through patient forums and foundation trusts. 4. They are being asked for their views routinely and listened to as part of every local services effort to achieve the best performance ratings. Among many issues concerning patients, safety is uppermost in the NHIS agenda. Achieving a high-quality health service which is responsive to people's needs means giving organizations and frontline professionals the freedom and support they need to work more effectively, encouraging staff to develop new skills and think radically and flexibly about how to improve local services. Throughout all this change, patients need to know that the care they receive is safe and is of a high standard. Staff, too, need to know they are working within a system which protects the patient, and where mistakes are made, they can report these to benefit others without the fear of being unduly blamed or punished. 1. At the national level, the star rating system measures the standard of treatment at each HMO and how well patients do after their treatment. In addition, the National Patient Safety Agency is working to encourage staff and organizations to report adverse incidents, mistakes which have endangered the well-being of patients. The agency's aim is to gather and analyze this information and then share it across the whole NHIS so everyone can learn from it. 2. At the local level, every NHIS organization must have in place a system for clinical governance. This is a clear and formal reporting process which allows organizations to safeguard high standards of care as well as continually improve the quality of their services. A very important issue, choice of patient, was introduced to put patients in the driving seat, giving them real control over 1. Appointment dates and times, so they can fit their treatment or hospital stay around their family and work lives. 2. Where they get their treatment, so they can choose the hospital or place of treatment which is right for them, whether that's the hospital nearest to where they live or the one with the shortest waiting list, perhaps the one with the most appropriate specialist, or the one which has the best patient feedback. But choice is also about giving patients the power to drive up standards within the health service. Radical changes to the way hospitals are funded means hospitals are paid for the activity they actually undertake. Therefore, it makes sense for hospitals to ensure they are providing the sort of high-quality responsive services that will attract patients who have the power to choose. Giving patients choice over when and where they are treated and more control over their own care means little or nothing if they are not supported by the right information at the right time. Quality services are those that not only have the best health outcome for patients, but also put the patient at the center of their care. Quality services can be accessed quickly and conveniently by patients when and where they need them. They are services delivered by the professionals with the most appropriate skills. They are tailored to each individual, and these include all the care that patient might need, not just part of it, as well as treating patients for coronary heart disease. For instance, a quality service will offer a patient help to quit smoking and take more physical exercise. There have been some important developments in the last few years to ensure that NHIS organizations and staff are properly rewarded for delivering high-quality patient care. 1. Quality, not quantity. For the first time ever, the new primary care contracts governing the way HCPs and their teams are paid rewards practices for the quality of care rather than the quality of patients they treat. 2. Funding follows patients. Changes to the way primary health care providers are funded means all NHIS primary HCPs will soon be paid for the actual activity they carry out. With patients increasingly able to choose where to get their treatment, it means that there is a greater incentive than ever before for hospitals to keep waiting times down and push up quality standards. Primary healthcare providers. Primary healthcare providers will serve as the first contact within the healthcare system, and they include private clinics or hospitals, primary healthcare centers, nursing and maternity homes, and outpatient departments of hospitals or clinics. Primary healthcare providers are mostly concerned with a patient's general health needs. Increasingly, more specialist treatments and services are becoming available to primary care settings. Health Maintenance Organizations, HMOs. These are limited liability companies which may be formed by private or public establishments or individuals for the sole purpose of participating in the insurance scheme. They are registered by the scheme to facilitate the provision of health care benefits to contributors in the formal sector social health insurance program. Their functions include the following. 1. They receive or collect contributions from eligible employers and employees. 2. They collect contributions from voluntary contributors. 3. They pay health care providers for services rendered. 4. They mention quality assurance in the delivery of health care benefits in the formal sector social health insurance program. Secondary and tertiary health care providers. Secondary health care providers provide health services on referral from primary providers, while tertiary health care providers provide health services on referral from primary and secondary levels. Referrals are undertaken essentially to ensure cost effectiveness and efficiency in patients' management under the NHIS. A patient may be referred from a primary to a secondary service provider due to need for specialized investigations, for medical or surgical reasons, or other services diagnostic, physiotherapy, etc., or from secondary to tertiary level. Approval by the HMOs is necessary, except in emergencies where they cannot be reached, and notification of such should be served within 48 hours. The various types of secondary and tertiary healthcare providers will include dentists. Dentists mainly provide dental services, and they are also responsible for checkups and treatments such as fillings, extractions, fitting bridges and dentures, as well as scaling and polishing. Part of their work involves advising people on how to look after their teeth and gums in order to prevent dental problems in the future. Dental practices can take private and NHIS patients, with most taking both. Pharmacies supplying prescription and over-the-counter medicines and healthcare advice to patients and members of the public. They dispense prescriptions and can advise on a range of ailments such as minor injuries, skin conditions, and allergies. They can help you decide whether or not you need to see a doctor. One can talk to his or her pharmacist in confidence, and he or she does not need to make an appointment. The federal government of Nigeria is committed to making even better use of the skills of pharmacists to widen the range of quality health care and advice available in convenient community settings. Opticians carrying out eye and sight examinations, prescribing and fitting spectacles. There are three kinds of opticians that provide eye services to the general public. Ophthalmic medical practitioners are qualified doctors who specialize on diseases and abnormalities of the eye. They will test your eyes, examine the health of your eyes, and give a prescription for spectacles. Optometrists, also known as ophthalmic opticians, are the opticians you are most likely to visit for sight tests and spectacles. They are also trained to recognize abnormalities and diseases that are revealed in the eye, such as diabetes and glaucoma. Dispensing opticians are qualified to fit and supply spectacles to a prescription provided by an optometrist or ophthalmic medical practitioner. Study session summary. In this lecture, we have discussed the levels of healthcare services in Nigeria, as well as some recent developments in the healthcare financing. In this process, we critically examine the primary, secondary, and tertiary levels. This will be complemented with examining recent developments in the healthcare financing in Nigeria. We also discussed extensively the National Health Insurance Scheme, NHIS, which is a new mode of health financing in Nigeria. That ends study session 8. Thank you for listening.